Hello and welcome to Cornell Keynotes. It's great to be back with another public health keynote where today we will be talking about wildfire smoke and its impact on health. I'm your host, Sabine Jamal, and joining us in the studio today are Alistair Hayden, Assistant Professor of Practice in the Cornell University Department of Public and Ecosystem Health and a volunteer firefighter, Olivia Sanderfoot, ornithologist and global change ecologist in the Center of Engagement in Science and Nature at the Cornell Lab of Ornithology, and Corinna Noel, Assistant Professor of Practice within the Department of Public and Ecosystem Health at Cornell University. As always, we will be taking questions from the audience, so please feel free to put them in the chat. Panelists, thank you so much for joining me today.
Thanks for having us.
So to start with, I'd love to hear about how each of you are involved in wildfire smoke and its impact and how that connects to your work. Corinna, I'd love to hear from you first.
Great, thanks, Sabine. Yeah, so my name is Corinna Noel. I am an epidemiologist and I work on a variety of public health issues. Most recently, I've been looking at the effects from wildfire smoke on health and also do some work in the mental health and substance use space. And so my work really centers on helping practitioners make data-driven decisions. And so I do that either through the development of tools that help disseminate data or research that helps estimate some of these effects. And so I've always really been interested in these environmental and behavioral effects on health. Most recently, this has involved some collaborative work with specifically Alistair Hayden, my colleague here on this call. So we've done a variety of wildfire smoke related projects, including trying to assess the experiences and perspectives of New York State residents after being exposed to smoke, and also trying to estimate some attributable deaths in the United States across decades to try to inform some policy decisions. So I'm really pleased to be here and be part of this conversation.
Thank you. Alistair, how about you?
Great. So my work on wildfire smoke, I work a lot with Dr. Noel, and so a lot of it is similar questions, thinking about how bad is this problem? So before coming here to New York, I was an emergency manager in California. No stranger to wildfires out there and wildfire smoke. And one of the questions that I feel like we get a lot from our practitioner friends is, how bad is this hazard, especially when it's a new and growing hazard? So a lot of my work focuses on, really how bad is it, and then how do we protect the public from it?
Thanks, Alistair. And Olivia?
Hi, everyone. My name is Dr. Olivia Sanderfoot, and I study how wildfire smoke impacts birds. So I have a very different perspective on the topic from my colleagues here on this call. I'm especially interested in understanding how birds respond to smoke disturbance and discovering the coping mechanisms that birds use to mitigate risks associated with smoke exposure. And to do this, I leverage participatory science, which is public engagement in scientific research. And here at the Cornell Lab of Ornithology, I lead Project Feeder Watch, which is a place-based participatory science monitoring program tracking trends in bird populations in the United States and Canada. I'm new to this job, but I really look forward to using this particular data set to help unravel this mystery of what smoke means for birds.
Great, thank you all. Really excited to hear from all of you and all the different perspectives you bring. So I'd like to start with setting the stage. And so, Alistair, it seems that there's more smoke around these days. Is that accurate?
Yeah, so you're not alone in noticing that millions of folks around the US and North America have been experiencing increases in the frequency of smoke days, as well as how much smoke actually occurred on that day from these wildfires. And so, if you only remember one thing from this talk or this chat, the future is going to be smokier, and we can go into depth about why that's happening, what we can do about it, what the impacts of that are. But we know that that the future will be smokier than it has been. And one reason related to that is actually that North America and our ecosystems here really love and are used to wildfire. And so all of us here grew up in an era where wildfire was suppressed. And so we actually grew up in a low fire era. It doesn't matter, everyone from my 1-year-old nephew to my 96-year-old grandma, all of us grew up in this era of lower fire than there should be in our ecosystems and landscapes. And so we're just now kind of getting a taste for what our ecosystems here need to be healthy, and happy to chat more about any aspect of that.
Yeah, so it sounds like there's been some shifting patterns. What might be causing that?
Yeah, so talking to researchers and practitioners, there's kind of three themes that you'll hear again and again in kind of like different balances between each other. But one is our shifting weather patterns. So there have been increases in the amount of fire weather. That's the kind of thing that we track in emergency management, the number of days that are where we're like worried about there being a fire, and that can let us pre-position our resources. So this is something that's well tracked, and we see it, the number of days and intensity of these days increasing through time. So changes in weather patterns is one to remember. A second one is this fire deficit that we've had. So over the last 100 or so years, we've been very, very good at putting out fires. And I don't just say this as a volunteer firefighter. This is like actually a thing. We've had a big policy in the US about putting out wildfires as quickly as possible. And we've just been very successful at this. So the fuels are building up in the forest. So our ecosystems are primed in many locations to, if there is a little ignition, if the weather is bad, there's a lot of stuff that can burn. So fuels is part two. And then part three is shifting patterns of where people live. So our population is growing. All these folks need somewhere to live. And in many parts of the country, it's cheaper to live out in areas where you're surrounded by flammable materials. And so the more people who live in areas where they could accidentally start a fire, actually 84% of wildfires in the US are started by people. So the more people are out in these flammable areas, the more likelihood there is for a wildfire to start, and then more people in harm's way. So there's three things, different groups of them in different places: the weather patterns, the fuels, and the people.
That's really interesting and kind of ties into a lot of the other stuff we talk about on these keynotes. So we are all based in New York, and I know we've got people joining us from around, but something that we have all noticed is there seems to be some regional changes, especially in the East, where we are seeing more wildfires and smoke than previously. Is that true as well?
Yeah, so there definitely has been a especially recent increase in these really high smoke days. 2023 was that really bad year in June for folks from basically the Great Lakes region, Mid-Atlantic region. A lot of states had this. And those were not our fires. That's smoke blowing in from really far away. And so basically, if you can get really huge fires putting out a lot of smoke, you get really big weather patterns bringing that smoke, you can just get pretty unlucky and be downwind. So here on the East Coast, we often are downwind of these fire events elsewhere, and it's just a matter of whether that smoke is going to blow to our location and then be down at the level where we're breathing it, because it could also be higher in the atmosphere and just go out to sea, and we would not experience that if it's up there. It's only when it's down here. And that's us in the Northeast here. Other parts of the US actually are much more familiar and comfortable with wildfire. So in the Southeast, there's a lot of communities and ecosystems where they conduct, we call it prescribed burns. They do very managed, controlled fires that mimic the natural fires. And it's just, you go out, you go out back and you do it. And your neighbors all know because they're doing it too. And so it's, different parts of the US, even within the East Coast, have very different experiences with wildfire and wildfire smoke.
Thank you. And switching more to thinking about a population perspective, what makes wildfire smoke a particularly challenging risk to manage?
Yeah, so there's a couple of different challenges that come up with wildfire smoke. So one is it's really hard to predict where it's going to go. And so even we know the fire is happening, it's currently happening here, all the modeling to be able to predict and give communities a good warning of, hey, it's going to be in your community. That is really hard, and we can only give communities at most like 24 hours warning on a good day. And another like really important one is that smoke can be so widespread. It's not just one location. A lot of hazards are going to impact a specific community. But as we saw with like those 2023 wildfire smoke events, it's several states all being impacted at once. And so even if it's just a little bit bad in a lot of places, that adds up to a huge impact. And it just impacts so many different things. It impacts our bodies and our health. It impacts our performance. And so actually that then has a lot of economic impacts. And so we can talk about, there have been studies about how wildfire smoke not just increases deaths during and after the wildfire smoke event, but it also impacts like workplaces. And so we're losing, I think some of the studies are saying like $100 billion a year due to lost workplace productivity, lost earnings, that kind of thing. And there are so many different sectors that are impacted in so many different places that really just make this a challenging hazard to manage.
So we have our first question from the audience, and our audience member is asking, they are saying that managing smoke in the air requires different approaches and that wildfire is obviously not good for the public health. Are there any innovative approaches to stopping this that any of our panelists are aware of?
I'll just jump in since I've already been talking. And I think one thing that I really want to emphasize is we know the future is smokier. And so one of the options that we have is to conduct more of this good, healthy fire, which we can do at the time and place and intensity of our choosing. And there's some evidence, actually a recent paper just came out giving further data that it does really seem like if we conduct these prescribed burns, the overall smoke exposure to the population will be significantly lower than if we just let the megafire happen at the time that it chooses. So one of the key things in our arsenal from a huge population standpoint, and given that the future is going to be smokier, we can make the choice to conduct these prescribed burns and release smoke at our time and place of our choosing.
That's
I
really
second
interesting.
that, and I'll add that by conducting more good fire, by putting more good fire back on the landscape and mitigating some of these catastrophic fires, we're going to be better positioned to prevent catastrophes like the LA fires that occurred in January 2025, where fires are occurring close to the urban wild interface and in the urban wild interface and spill over into infecting cities. And when cities burn, the toxins in smoke are very different than what's in smoke when natural vegetation burns. And it's far more toxic. I mean, when cars and plastic and metal burn, there's so much stuff that's in the air that wouldn't be in the air if just trees and grass burned, which is what happened, historically before people moved into these landscapes. So it's something to think about too, by putting more good fire back in the landscape and preventing these mega fires that lead to these massive smoke events with significantly more toxins present in the atmosphere that can lower the human health exposure to some of these compounds we're worried about too.
So it sounds like we're talking about two things here. We're talking about fires in general, but those are not necessarily a bad thing. And even smoke is not necessarily a bad thing. It all depends where it's coming from and who it's affecting. So speaking about kind of those effects that wildfire smoke might have on people, Corinna, what is the current data telling us about the health impacts of wildfire smoke?
Yeah, great. So unfortunately, health effects from wildfire smoke are pretty well studied and wide ranging. So this field has really rapidly expanded in the past 20 years. Although it's important to note that most of the research focuses more on short-term exposure. So think things like exposure to 1 or 2 days of wildfire smoke, as opposed to long-term cumulative effects. But that data that we do have suggests that there's a range of health effects essentially from exposure to wildfire smoke. So it ranges from more relatively minor effects. So thinking about things like eye irritation or scratchy throat or mild cough, to more serious effects. So things like if you have asthma, worsening symptoms, reduced lung function, increased risk of acute bronchitis or COPD, and premature deaths. So Alistair alluded to the research that has suggested that Deaths have increased following times of smoke events. And actually, one research has suggested that annually, kind of more long-term exposure to wildfire smoke is responsible for about 24,000 deaths of all causes per year in the United States. The most consistent evidence that we do have is related to respiratory-related health effects. So think things like increased in respiratory-related emergency department visits or hospitalizations or even respiratory-related deaths. We do have some evidence to suggest there's certain more vulnerable populations that might be affected. So for example, for pregnant women, there's some research that suggests an increased risk of low birth weight and preterm birth for babies who have been exposed in utero. There has been a bunch of work that's suggested that there are certain populations that are more vulnerable. So young children, older adults, certain areas of lower socioeconomic status, people with pre-existing health conditions, and certain workers that work outside and are exposed to the elements. So a lot of work has recently been disseminated lately related to wildland firefighters, for example. But there's actually a lot that we still don't know. There's a lot more we could learn, for example, on the effects of child health with wildfire smoke exposure, particularly downstream. We don't really know much about different patterns of wildfire smoke and whether or not there's differential effects on health. So as I mentioned, most of the work has been done with relatively short-term acute exposure to wildfire smoke. But what about maybe persistent periods? So multiple days of wildfire smoke or multiple days over multiple years, or a low level at for years and years. And so there's still a lot that we don't know, but what we do know is not necessarily great. And then just one other thing to add, something that could be studied a little bit further is trying to understand what the interaction is with wildfire smoke exposure and other climate-related risks. So thinking about things like exposure to even moderate heat, does that accentuate your risk of death? And some work has been done on a regional level. So thinking about, the state of California has published some work, and also British Columbia in Canada, but less so on more of a global level.
And your work looks at smoke-naive populations, and given what Alistair was saying about how we've gone through a low smoke time to now we're going to get smokier, has anything stood out to you from findings specific to those smoke-naive populations?
Sure, and just to provide context, so this is in reference to some of the work that Alistair and I have worked on together. We assess the perceptions of New York State residents in summer 2023, that time of days, prolonged days of pretty intense wildfire smoke exposure. And as we've talked about, New York State is not a population that's used to these kind of smoke events. So we wanted to know how folks were responding. And it's important to note this was not a representative sample. We essentially used convenience sampling from some of our networks to understand how people were responding. But even with that in mind, 85% of the folks that responded to our questionnaire thought that wildfire smoke was a natural hazard and subsequently took mitigation actions. So almost all of our participants, about 93%, took some sort of mitigation action. So using an air filter at home or wearing a mask when they were outside. And still, despite that, 87% reported experiencing at least one symptom that was associated with wildfire smoke. So the top symptoms that we saw were watery eyes, irritated throat, and headaches, with actually women reporting symptoms more frequently than men, which has also been supported in the literature. And something that was particularly of interest to me as someone who also studies mental health, we had about 1 in 5 of our respondents reporting some mental health related symptoms. So thinking about things like fatigue and anxiety during times of wildfire smoke, which was just something that was interesting and kind of piqued my interest in this area.
And is there any research coming that you're aware of, or is that mental health impact of wildfire smoke an area that might be expanding in terms of research?
Yeah, so I of course looked into this after this finding, and it seems like it is a area that is increasing, particularly in the past 10 years, but it's far less studied compared to the effects on physical health. So there has been some work that's focused on more the acute trauma of experiencing a wildfire smoke related event. So thinking about things like losing property or having to evacuate your home. But less has focused on kind of just the exposure to wildfire smoke. There is a growing body of evidence that suggests there is some association between increased exposure to pollution more generally in mental health, so increasing the risk of depression, anxiety, suicide, and other types of psychological distress. When we look into the literature specific for the mental health effects on wildfire smoke, it is a bit varied. I think mainly due to the differences in methods, but there has been work that has suggested that symptoms related to anxiety or worrying, consistent worrying increases during times of wildfire smoke, as do sleep disruptions or fatigue, distress, or depressive symptoms. And actually in California, in 2020, there was a study that suggested that there was an increase in mental health related emergency department visits up to a week after times of wildfire smoke. And this effect was more accentuated in some more vulnerable populations, so young children, Black and Hispanic individuals, and Medicaid enrollees. And so it has been hypothesized about what maybe some of these mechanisms for poor health are. And some folks have been suggesting that it could be related to feelings of isolation or being required to be inside during times of wildfire smoke wave, or even the lack of physical activity, which is often a kind of stress relief for folks. But there is a lot of work that can still be done in this area. I think there's a lot that we still don't know. And that we could study, these different types of mental illnesses or symptoms in stronger study designs than exist right now. So a lot to learn.
It sounds like we might be maybe underestimating the true burden of wildfire smoke on some communities.
Yeah, I think that's definitely true. I mean, the evidence tells us that there are effects, but I think there's a lot that we still don't know. And, I have mostly been talking about the human health impacts, but of course, as we know, that's not the only impacts that we should be considering. And so I'll kind of hand it off to you, and I know Olivia has some things to share.
Yeah, I building on that comment, Corinna, I worry that we're really not thinking about how wildfire smoke is altering our experience of nature, right? Like you hinted at how when folks spend more time indoors, they might be more at risk of physiological distress, and we know that that's true. We know that going outside makes us happier. We know that listening to bird song makes us happier. So during days when air pollution is hazardous and people are encouraged to spend time indoors with their windows closed and their air filters running, how does that exacerbate existing mental health issues? How does that trigger mental health issues? Birdsong in particular captures my interest as an ornithologist. I know how joyful birdsong is for me. I think that's true for many, many people. And we know from some really compelling interdisciplinary research that people are generally happier in places where they can hear birds or more birds are available for them to observe. And this is true whether or not they know their names or can identify their calls or songs. So even if you're not a birder, chances are if you can hear more bird song, you will feel lighter and happier than if you're in a place where you don't. And so not only does the experience of our day-to-day lives shift so much during wildfire smoke events because we are indoors, and that might be impacting our mental health. But even when we go outside, if that experience is fundamentally different, if birds aren't singing, how does that shape what nature does for us and how restorative it is and how meaningful it is in combating mental health issues? There's some preliminary work that suggests that in places as far-flung as the Pacific Northwest to grassland ecosystems here in New York State, that birdsong is is less salient, that birds vocalize less when it's smoky. We don't exactly know why, and we don't know if that will be true everywhere, but just imagine if you walked outside when it's smoky and it was quiet, right? That's the experience a lot of people are having right now. So not only is it eerie and it smells bad and you feel crummy, but it's quiet. And I think that's really unsettling to folks.
Yeah, absolutely. Kind of a bit of a quietness over here because it doesn't sound fun at all to experience that. So you've talked about birdsong, Olivia, and how that affects kind of humans, but what's going on with the birds? Why aren't they singing? Can you kind of tell us a little bit more about how birds experience smoke?
Yes, absolutely. So I study birds because birds, well, first of all, I'm an ornithologist, so of course I study birds. But in the context of wildfire smoke, birds are a particularly useful indicator species because they are so vulnerable to air pollution generally. And we've known this for a long time. Folks might have heard the phrase canary in a coal mine. This is generally used to refer to an early warning signal of some future danger, and it comes from this decades old practice of bringing canaries down into coal mines to monitor for levels of noxious gases such as carbon monoxide. This really did happen. People brought caged canaries with them into coal mines, and if the birds fell over or died, that signaled to the miners that they needed to get out of there. And now we use the phrase canary in a coal mine. And this practice continued as late as like the 1960s. Now we have much better technology, but we've known for a long time that birds are more vulnerable to air pollution. The truth is that they're more vulnerable to wildfire smoke too, because wildfire smoke contains a lot of the pollutants that birds are just inherently more susceptible to. The reason for this is because birds don't breathe like we do, like at all. So humor me for a second, and if you're tuning in, take a deep breath. So we breathe in and out. That's not how birds breathe in at all. When we breathe in, our lungs expand and we pull in fresh air. When we breathe out, our lungs contract and we push out all of that stale air. And bird lungs are rigid. They sit in their chest cavity. They don't expand in and out. They don't move at all. And instead, birds use this system of air sacs, which essentially look like balloons, to constantly push fresh air into their lungs. And this unidirectional flow of air supports highly efficient gas exchange. Essentially, birds are able to take up about twice as much oxygen with each breath of air than we do. And that means they're also getting twice as much of the bad stuff that's in the air too. And on top of all of that, birds also don't have a diaphragm, so they don't have that same well-developed cough reflex that we use to kick out particulates that end up in their airways. So they're getting in all this nasty gas, and then they can't kick out the particulates. So they just unfortunately get really sick really fast when they're exposed to air pollution. And so I think that it's really important to get a good handle on how birds are responding to wildfire smoke so that we can better understand what this means for other species, including humans.
Wow, that's really cool. I had no idea. Thank you
A
for
lot of people don't.
teaching
So next
us.
time you see a bird singing, imagine that it has got this little tiny rigid lungs and it's surrounded by balloons, and that's how it's really cool. You should look up a video of it. It's quite fascinating.
Absolutely. So birds don't breathe in and out in the same way we do, and they don't cough. So what are some strategies that birds, or perhaps other animals you know of, might use to cope with excessive smoke?
Yeah. So there are a number of different physiological adaptations that birds and other animals might use to cope with smoke exposure. That's an active area of research. Birds and mammals other than humans do have this type of cell in their respiratory system called a macrophage, which is essentially a janitorial cell that comes through and sequesters all of this foreign debris and gets rid of it. It's pretty cool. Birds might not have as many of them as we do, which could be a problem for them, but the jury's still out on exactly how that plays out for them. Some birds might have a more successful cough-like reflex than others. There is some sort of cough-like action birds have, but again, it's not that powerful cough that our diaphragm helps us to use to cough up debris. And you can think about a bird like a goose with a very long neck and a very long trachea and think, if a bird like that went, is that really going to work to kick out debris? Who knows? So we have a lot to learn about at a physiological level what birds are doing to cope with smoke exposure. My research is really focused on understanding the bigger picture strategies that birds might use to cope with excessive smoke. Again, this is an active area of research. Smoke ecology is an emerging field. And we're really not sure what animals are doing precisely when they are exposed to hazardous smoke, but we have an immense opportunity to dig into this using participatory science platforms like eBird and Project Feeder Watch. And I use these resources to ask this question in a few different ways. But most of my work comes down to what I like to call the stay, shift, go framework. So essentially, birds have three options when they encounter hazardous smoke. They can stay, they can shift, or they can go. So if they stay, that means they're going to do exactly what they would usually do in exactly the same spot. And because they're not doing anything differently, they're going to experience the full brunt of that smoke exposure and any adverse health outcomes associated with that. If they shift, they might do something differently when it's smoky, even if they stay in their location. They don't change where they're spending their time. That helps them to mitigate some of that smoke exposure. For example, they might sing less. And if birds are singing less, that might be a sign that they are resting, that they are lowering their activity, that they're chilling out and not exposing themselves to as much smoke as they would if they were running around. That's the same reason why you're told not to go for a run when it's smoky, right? That increases your exposure to all of this toxic air. Maybe birds intrinsically and inherently know that they should take a chill pill when it's smoky and not work so hard. And then there might be birds that leave altogether. And so they're just getting out of town and they find a new spot. They leave in pursuit of cleaner skies. And so I'm using data from participatory science programs that leverage observations from birders all over the US, all over the world, to better understand what birds are doing in real time, where we see birds and where we don't, and what that means for these stay, shift, go strategies.
And has your research so far yet shown if there's a time element to this? For example, are birds doing some of these things before we even clocked their smoke, or they might try one strategy and then move to another?
That is fascinating, and we are definitely interested in exploring those hypotheses. I don't have any preliminary evidence to suggest that yet, but I think there is a real potential that birds pick up on smoke before we do, or that their behavior changes at much lower levels of smoke that we might not detect as people. So our monitoring instruments might know that particulate matter associated with smoke is going up, or that ozone in the area is increasing as a result of wildfire activity from faraway places. But that doesn't necessarily mean we notice it, right? Like, I don't know that I would know if I walked outside if the air pollution was moderate versus unhealthy for sensitive groups. I might not pick up on that, but maybe a bird would. And if we could bring that into the mechanisms that we use to track air pollution and understand risks, I think that would be just fascinating. There's also a lot of there's a huge need to understand what birds are doing when it's smoky, to understand where they're going to end up and how we can then help them when they land, right? So if wildfire smoke during migration is causing mass disruptions in where birds are landing, which stopover sites they're using, how long it takes them to make these epic journeys across the United States, where they land might be very different, and what they need from us might be very different. And it's also possible that if we were able to forecast that, we could give people alerts to say, just like you need to protect your health, hey, these birds are coming to you, and this is what you can do to help them out because they've had quite a day.
And just to keep pushing at your kind of hypothesis button,
Mm-hmm.
how might smoke exposure interact with other risks, maybe thinking of disease dynamics or spillover events?
Yeah. Yeah, that's totally uncharted territory, but my worry is that increased exposure to wildfire smoke could make wild birds more susceptible to diseases, and the diseases that we care about as humans, right? So case studies from veterinary medicine show that when pet birds are exposed to household fires, to smoke from household fires, they're more vulnerable to respiratory illness. So, what if birds that migrate through smoke plumes are at greater risk of succumbing to diseases like avian flu, and how does that impact spillover to other populations, including mammalian populations? We really don't know. And I think it's important to understand because it could influence disease modeling and our understanding of risks to other populations of animals that we care about and our human communities too.
Super interesting stuff.
Can I jump in on that one too? So
of course.
there's some really interesting work that I know very little about, other than it has a very cool name, which is called pyroaerobiology. And it is basically looking at whether pathogens can be transferred on wildfire smoke plumes. And so if you have, especially, I think mainly thinking about ecosystem pathogens, so impacting creatures being transported long distances on the back of smoke. Again, I know very little about it, but there's some really smart, awesome people working on it. And it's something I will be curious to learn more about too.
Well, for a cool name alone, Alistair, that
Yeah.
was a really great mention. Thank you. So I have some questions to kind of bring that ecosystem and human health together. But before we do that, we've had some questions come in from the audience. So I'm just going to kind of ask them all, even though they're a bit unrelated, but I'd love to get some answers to these. So the first one is, I think, Alistair, perhaps I'll pose this one first to you. Are there specific regions looking forward maybe 10, 20 years where we might expect to see specific increased levels of smoke?
Awesome question. I've been trying to get an answer to this as well. It is very difficult. So rather than give you an actual answer, I'll tell you why it's difficult, because we don't have the actual answer. So basically, even if we were able to forecast exactly where fires were going to be and how intense they would be, how long they would burn, there's just so many things afterwards that then, and that alone is difficult, just knowing where the fires are going to be, when they're going to occur, how big they're going to be. That's like a whole field of work. Then you have to take that and then think about all the atmospheric models. What is weather going to do from that wildfire? Where is that smoke going to go? And even just something as different as shifting it from a July to an August fire. Well, wind patterns, circulation patterns are different on average in these different months. And so if you're moving when the fire is happening by a little bit, that can really change where it ends up. And again, remember, especially the us exposure component, it has to be smoke that ends up down at ground level. It's not just anywhere in the atmosphere. It has to go up, it has to come back down and be where we are, or it has to stay down here. And so all these pieces have to plug into each other. Oh, and then there's the additional complexity of when fires get big enough, they actually create their own weather and change weather. And so if you take this computer model that works great for fires and this computer model that works great for the atmosphere, you stick them together, you're not going to get the right answer because the fire is changing the atmosphere. And so it's just so hard to know, even on a, forecasting on the short term, let alone the long term, which regions will be disproportionately more exposed than other regions. And so the best answer I get to this from talking to researchers and land managers and folks out there is just we should all be thinking about a smokier future and what we're doing to prepare ourselves and our communities for it.
Thanks, Alistair. And our next question, Corinna, I'd like to pose to you. Have the environmental effects or human health effects of fighting fires been studied? So the question is specifically asking about maybe the agents used to extinguish the fires.
So yeah, the foams that we are using to extinguish. Yeah. I know there is some work that has been done related to this. I don't know that field well enough to say with certainty. I do know that there have been some more recent work related to individuals that are exposed to smoke on a regular basis. So think about like wildland firefighters, and I'm not sure if the folks in the audience have seen, but there was a whole series of New York Times articles about that recently, which I encourage you to read up on your own time. But it's really quite alarming. Although it's important to note that these are individuals who are exposed to a much higher level of smoke than just everyday citizens. But that is a really good question.
And if I can add a little bit to that one, so I also don't know the full literature on this, but one thing to just clarify is that fighting a wildfire is actually quite different than fighting a structural fire. So when we fight structure fires, we're out there, you put water on the hot thing. That's pretty much what you do. There has been a lot of work on over a large number of decades specifically in the structural firefighting and airport firefighting space. There have been some foams that have been used to help smother the fire. And there have been there's a lot of PFAS in particular, a forever chemical in those historical ones. The modern foams have a different makeup. So that's the structural firefighting and like vehicle and airplane. In the wildland fire space, it's a totally different set of tactics where our goal is not to put out the fire, it is to contain the fire so that it burns everything out. So the common tactics are you actually just go out there and scrape up all the vegetation, whether that's by hand, like literally, they're called hotshot crews, and they're out there just scraping away, cutting things down. And so that, that's one set. And then the other set that would have potentially more chemical contamination is in some places, especially out west, they deploy some fire retardant materials. And so that's if you've ever seen the airplanes coming by and dropping the red stuff, that's called Phos-Chek. And that is just another way of creating a fire break. But again, that's not extinguishing it. And so the amount used is, perhaps quite different than if you're imagining structural firefighting where you're spraying it right on the fire. So that's still not directly answering your question, but just it is important to keep the tactics kind of different because the chemicals used and the amount of chemicals can be quite different.
And I imagine there have been studies in firefighters specifically, but that's different in itself because they do both and then they have protective equipment. So that might not necessarily translate to what you're looking at, Corinna, with the general population. Great. So, oh, sorry, just one question has just come in for the audience, which I'd like to ask straight away. So, have there been any studies with birds' lower activity or migration and whether this has impacted flora or fauna in the area post-wildlife? Olivia, if that's for you.
Yes. Okay. There are a lot of parts to that question. So hopefully I will remember all of the parts. So there have been a few papers looking at how proxies for bird activity has changed during and after smoke events. A paper that I led as part of my PhD looked at how our probability of observing birds changes with day-to-day exposure to fine particulate matter as a proxy for smoke, and we found that we're more likely to observe some birds and less likely to observe other birds, and that tells us that there's some sort of behavioral shift that birds are using to respond to smoke, and that different species respond in different ways. That's really interesting. One of my undergraduate researchers at UCLA when I was a postdoc there, Anna Nihei, led a great paper looking at bird banding data from a long-term banding station in the San Francisco Bay Area to look at how acute and chronic exposure to PM 2.5 during the fire season, again using PM 2.5 as a marker for smoke exposure, impacted the number of birds captured in our mist nets. So it's very common in ornithology to capture birds in mist nets in order to take individual evaluations of birds and band them for long-term monitoring. It's one of the best ways that we can monitor survival and really understand fine-scale movements of birds. And she found that birds were less active in the sense that we caught fewer of them at our mist nets during times in which smoke exposure was likely when PM 2.5 increased. Intriguingly, she found that after repeated smoke exposure, if the banding station was exposed to more smoke over the course of the fire season, we actually caught more birds, which could suggest that birds are less active when it's smoky, but that comes at a cost, right? There's now a caloric deficit. Birds need to eat quite often. They have high metabolic rates. If they're hunkering down to avoid smoke exposure, then maybe they actually need to increase their activity as the summer goes on so that they can forage more and make up for that caloric deficit. They really need to be out more to eat more. So there's a lot going on here, and there's a lot of different ways to tackle this question. And the way that I'm looking at this now is by using participatory science data, namely from Project Feeder Watch, which is the participatory science program that I currently run. This program is focused on monitoring winter birds in the US and Canada from November through April, but we've now seen some really extraordinary historic wintertime fires within our study area, including the LA fires that my family and I evacuated from when I was a postdoc at UCLA. And we're planning to use the Feeder Watch data set to understand how birds are responding in real time by looking at what our participants observed on the ground near the burn perimeter and at further distances from the perimeter with respect to smoke exposure. And those counts will tell us a bit more about how populations are responding. Regarding flora and fauna more generally, I am an ornithologist, so I would prefer to keep my commentary on the birds, but I did lead a literature review back in 2021 as part of my PhD that summarizes the state of knowledge as of about 5 years ago on wildfire smoke on wildlife generally. And we do find that different species respond in different ways. There's some really interesting responses in marsupials and marsupials like wombats. They actually might go into torpor, which is sort of a short-term hibernation state when they detect smoke, and that might be a response for them to avoid the fire, right? So if they go into short-term hibernation, they find a good, sheltered, carefully thought out spot to hunker down from the fire. That smoke exposure could tell them that it's time to go there. So anyway, lots to dig into there. I don't know anything about plants, but I know that smoke can trigger a seed germination for some particular plants in fire-prone ecosystems. That's about the extent of my plant knowledge, but totally worth investigating. There's a lot to dig into there.
Thanks, Olivia. So with about 10 minutes left on our keynote, I'd like to encourage audience to ask any more questions they have. And whilst you're doing that, I'd like to ask first Alistair and Corinna, and then Olivia, how do we as individuals, how do people that aren't necessarily in the research space help our human communities? And then once we've talked about that, Olivia, I'll ask the same about our animal communities.
Great. So I'll hop in first. I like to think about this kind of in 3 steps, which can apply pretty much to any hazard, actually. So the first one is just get good information. And for wildfire smoke, the best information, the best resource right now is fire.airnow.gov. So this is a website from the United States EPA. They have sensors and monitors all over the US that are feeding live data into this website. There's also, you can go out and purchase your own sensor. They're, I think, around $300 right now, and you can attach it to the internet and it will show up on that map. And so this is amazing real-time data that you can use to make decisions for yourself. So it's literally real time. So you can, we talked about the mental health impacts of being stuck inside for days. So you can use this to say, I know it's going to be bad for days, but I just need to get out there. I need to walk my dog. I need to do it at a time that is going to be least smoky. And you can just sit there and watch the numbers and make a decision that's right for yourself. So that's great. You can also check on your family members anywhere in the US. Like it's just such a rich data source. So step 1 is get data. Step 2 is protect yourself. And so generally that is the kind of recommendations we've been talking about. So avoiding the smoke as much as possible. Perhaps that's staying inside, closing the windows, using an air cleaner if you have access to these things. I personally love the do-it-yourself air cleaners where you just duct tape an air filter to a box fan. There's been a lot of research at this point. They're safe, they're effective. You can, they're usually in the store, even if the air cleaners are sold out, you can get them. And then, we talked about potentially wearing a mask and timing your activities for times when the smoke is lower. We have some resources that we've put together, our team here, blogs.cornell.edu/wildfire, and that has some individual level advice as well as some of the community level advice. And so that's step 3 is, look out for your neighbors, look out for your community, check on the people who you might think are more vulnerable or might not know what's going on or might need some help adapting to it. And so our resource there has some information. Perhaps you're in government, where to get decision support for, do I close summer camps today? Things like that, if you're in a little more of a leadership role and need to take decisions. So yeah, the 3 steps: get information, protect yourself, and protect your community.
Yeah, and ditto with all of that. I think the one thing that I'll just add on and kind of links to something we've said earlier, which is this, expect a smokier future, right? So if it's not smoky right now, maybe now's the time to buy that air filter that's on sale, or stock up on N95 masks so you can have them in your closet on a day when it's smoky, or share with a neighbor. And so just anticipating that it's going to be smoky in the future and just being prepared for that.
Thanks, Alistair and Corinna. So, Olivia, what can we do as everyday people that might help our animal community?
I get this question a lot. There are lots of things that we can do to help birds, and I'll get into that in a moment. But this particular risk, it's hard to know how to help, and that's exactly what my research is hoping to answer. What can the everyday person do specifically when it is smoky to help birds? I suspect that one thing we will find is that putting out bird baths is very helpful. As Corinna nodded to earlier, birds, just like people, are under multiple climate stressors right now, and extreme heat and drought are compounding any impacts of wildfire smoke. And it's possible that when it's hot and smoky, maybe birds just need a little bit more water. So I don't have any evidence to back up that suggestion. And if you don't have a bird bath, that's just fine. You're not hurting the birds by not having one. And if you do have one, you should keep it clean. But I'm hoping to be able to put out some more specific guidance on that in the future. In general, I suspect that wildfire smoke for birds and perhaps other wildlife as well is really contributing to this story of a death by 1,000 cuts. We've lost 3 billion birds in North America since 1970. It's truly a catastrophic loss. And we expect that those bird population declines will continue if we don't take action to protect birds. And birds are an indicator species. They tell us how our ecosystems are doing. If our bird populations are stable and thriving, that means our ecosystems are healthy. And if bird populations are in collapse, that tells us something about our ecosystems. It tells us that we have some work to do. So the biggest risk to birds is habitat loss. We don't all have much control over that, but you do have control over your growing space, whether that's a tiny urban balcony or a yard in a suburb or a big property out in the country. You can take action in the growing space that you have to plant native plants and to increase shelter and food resources for birds, and really support insect populations that nearly every songbird in North America needs, particularly during the springtime right now when birds are breeding and taking care of nestlings and fledglings. The other thing you can do is keep your cats indoors, and you can prevent bird glass collisions by treating your windows. I know that these things are totally unrelated to smoke, and you might be thinking, like, this is a talk about smoke. Why is Dr. Sanderfoot mentioning all these other things? And the truth is that we can control these things, and we might not be able to individually control the smoke. And anything that we can do to help birds is going to help them be more resilient in the face of climate stressors that individually we don't have as much power to control. And it really will make a big difference for birds. And finally, you can contribute to participatory science so that researchers like me have this treasure trove of data to work from to answer these really tough questions. As Alistair said, it's really hard to forecast where smoke is going to be, which makes it really hard to plan field studies as an ecologist. So one of the best tools in our toolkit is participatory science. So I highly encourage everyone to get involved. And if you'd like to sign up for Feeder Watch and you're a first-time Feeder Watcher, you can sign up at no cost. Most of the participatory science programs are free as well. So if you have any questions, feel free to get in touch.
So in our last couple of minutes, Olivia, tell us about Feeder Watch. What would people be doing? What do they need to do? Why should we do it?
Yes. Well, I think you should do it because it's a great way to learn about birds, connect with the birds just outside your window, and boost those mental health benefits associated with birding. If it's too hot for you, if it's too smoky for you, you can still watch birds out your window. So it's a great way to connect with nature, even on a day when you don't want to go outside. You don't have to have a feeder to participate. There are lots of different ways to feed birds, right? That includes putting out plants for birds, especially native plants, feeders, bird baths. Really, as long as you have a place where you are trying to attract birds, an outdoor space that maybe you have a view of from a window or would like to spend time outdoors in, that's really just perfect. We do a 2-day count, and you record the maximum number of birds that you see during those 2 days. And we kick off in November for our 40th anniversary season. So signing up now gives you access to our 40th season, and all of the data will go toward this historic year. We've had some folks doing this for nearly the entire time, including over 1,300 folks who have been doing this for over 25 years across the US. So we're really excited about this anniversary, and I highly encourage everyone to get involved.
Wow, that's amazing. Well, I'm definitely convinced, and I also
Yay.
imagine anyone with children who
Oh,
Corinna
my
said are
son
particularly vulnerable.
loves it. Yes,
Yeah.
he's 2, and he's obsessed. He's definitely an active feeder watcher for sure. It's easy to
Amazing.
get kids involved.
Well, that is all we have time for today. I want to thank each of our panelists, Olivia, Alistair, and Corinna, so much for joining me, our audience for the thoughtful questions, and we look forward to seeing you next month for the next Public Health Keynote. Thank you so much.
Thank you all.
Thanks, everyone. Thanks, Sabine.